Hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my wonderful wife, Janet, and we are super excited to have Dr. Shawn Johnson on our show today. She is an orthopedic surgeon, and she's going to be discussing overuse injuries, which if you've followed Janet and I before, we've talked about the importance of cross training and the importance of breaks between sports. And there's so many young people now playing soccer year round or playing basketball year round, baseball year round, and it's causing a lot of young people to get injured. So without further ado, Dr. Johnson, welcome to our show.
Hello, good morning.
So tell us a little bit about your background and how we connected and how you're here.
So I'm Dr. Shawn Johnson. I am a native of Houston, Texas, and I completed medical school but hold on, it takes me a little bit. I got to think back. I completed medical school in 2003 in Dallas at UT Southwestern. And during that time, I was commissioned into the military through a healthcare scholarship program. After that, I went on to complete my orthopedic residency in El Paso at William Beaumont Army Medical Center. And it was a dual program with the county hospital there, Thomas and General. And from there, deployed a couple of times, PCS to Germany, stayed there, and then finally ended up back in Oklahoma at Fort Sill, where I decided to resign my commission because my ultimate goal was to go to do a sports fellowship. I got into orthopedics because I was interested in sports medicine. My initial career goal was actually to be an athletic trainer. But when I was in college, I realized that probably wasn't going to fulfill me, at least at that time. Now, athletic trainers have lots of different options professionally, so it's a little different landscape for them now. But then I was introduced to orthopedics during college and working with the student athletes when I was a student trainer then, and it led me to orthopedics. So anywho, resigned my commission, did an orthopedic sports fellowship in New Orleans at Ochsner, stayed on there for 3 or 4 years, and then decided to relocate home because I missed home. I hadn't been home since I graduated high school in 1994. So now I am serving Greater Houston. I actually live just west of Houston with my husband. And the story behind Austin County Orthopedics is one of my jobs once I got back was an employed position at a rural hospital in Belleville, Texas, which is located in Austin County, Texas. That hospital had not had an orthopedist for greater than 10 years. So I had to stand that program up. And the name of the department or the name of the department, the office was Austin County Orthopedics because it was located in Austin County. Fast forward 2.5 years, the hospital got bought out. And they decided they didn't need an orthopedist anymore, the new management. However, they had not registered the name of the practice. So I took it and registered it myself just to have some name recollection when I decided to transition into private practice, which is not something I thought I would be doing at 45 plus years old. So that's the story behind Austin County Orthopedics. I do believe I will be rebranding in a few years because it is super confusing for people who believe I'm in Austin, Texas.
Yeah,
which is Travis, which is Travis County versus Harris County or Austin County, Waller County. But it has allowed me to reestablish with some of the patients that I was treating at the previous practice because they recognize the name and they recognize the logo and they recognize my name. So it's captured a few people. It's done a little bit of its job, I guess.
Yeah, right.
Yeah. So on the topic of overuse injuries, I believe I have a fairly good background in that. Number one, having an athletic training background. Number two, one of my duty stations in the Army was a a training duty station where all of the incoming recruits came. So lots of people that were not used to doing exercise on a daily basis at the level of that they were required to do when they showed up to training camp. And then also just my sports background and being in orthopedics. And I see, although I'm trained or fellowship trained in sports, I'm boarded in general and sports, and working in rural communities, you can't really pigeonhole yourself into I only see this little small finger on the right hand. Like, you just can't do it. So I see a lot of different patients, young and old, pediatric, weekend warriors, the whole nine. Not all of them need something. Actually, in this community that I work in, most of them don't need surgery. Most of them need counseling and education on what they may be doing wrong when they are participating in sports. And like you mentioned in the intro, the number of children that I see now versus when we were growing up, I just don't remember my friends participating in year-round sports. I don't remember that. And definitely not year-round multiple sports. I don't remember that. So now I just had a patient Wednesday, actually, yesterday, that came in. It's my second time seeing her. She's in the 7th grade. She pitches year-round. Now she's in school and playing volleyball, and also getting ready to start her club softball. And I remember having a discussion when I saw her earlier this year about her pitching arm or throwing arm, that it was super important for her to rest. I don't know if she did that. Yeah. But now she's got some other issues going on, but that just brings it to the point that you made. The year-round sports and the multiple sports are really, although I encourage, and I think we all encourage children, especially now in the face of childhood obesity, to be active. It is a certain way that you have to control that activity. So multiple sports are good, just not at the same time, and that allows you to cross-train different portions of your body, and it takes some stress off of the one thing, like with throwing, like throw. If you do that, you can not only cause the overuse injuries, but you can cause some long-term changes especially in a skeletally immature patient. You can cause some long-term changes in their shoulder and in their elbow. Now, I will say some of those adaptations may actually predispose them to a better catapult. And allow them to pitch faster and things like that. But I just think it's a slippery slope for sure, and it has to be done in balance. The other thing that I noticed, not necessarily with children, but when we get more into the adults, is just that there's not enough cross-training. People say, well, I run every day 10 miles. And I'm like, well, yeah, I understand. That's
the problem.
That's the problem. It's okay not to run every day. It's okay to cross-train with another form of exercise, weightlifting in particular, and flexibility, which I tend to see is the most neglected part of everybody's workout, is flexibility. Not everybody, but the civilian athletes, if you will, the flexibility portion of it, rest, not having to necessarily do it every day. And as an orthopedist, I tell my patients all the time, I usually will not tell you do not exercise. I won't tell you that. I'll say do it in moderation. Find something else to do that still gets your heart rate up and allows you to rest particular joints and muscles and things like that. I'm not sure. I think for me, probably the most in children, the most common overuse injuries I see are, if they're overhead athletes, obviously in the shoulder and elbow. And a part of that with the shoulder and elbow in children is because God bless the coaches that are out there on Saturdays and in the afternoons with these kids. But sometimes they don't necessarily have the right training to educate the children on pitching mechanisms, throwing mechanisms, pitch count, things like that. And a lot of times what I'll see is as these kids get old, as they're going from one level to the next, they're just told pitch longer and faster. Yeah. And mechanics are, most kids are trying to get their power from their upper extremity, which is not the way to go. They have weak core, they have weak abductors, they have weak trunk, weak everything, but they're trying to give it their all just from here. And that's how you get injured. So I find myself having to explain that. And it really is a little touchy because the coaches, say one thing and then they come see me and I'm telling them something different. So I try to identify, at least in the communities that I serve, a location where the kids can go, therapy location, pitching coach, something, if they're really into this, to go and learn some pitching mechanics and learn how you need to strengthen your core and your hips, because that's where your power should be coming from, not necessarily, not your upper extremity. So it's a lot of education. And I think the biggest thing they hate to hear me say is you got to rest. You got to not pitch. I mean, that's just the bottom line of it. If you have, especially as a child, if we can get this corrected without having to do something to you, then that's going to be the best. And I encourage kids, I said, if you are seeking to be an athlete at the collegiate level or beyond, you have to take care of your tool. This is your instrument. You have to manage it well. And only you can say, we can sometimes see if somebody's not doing well, but just like yesterday, the kid that I saw, she hurt herself in her volleyball game, came out of the game, got taped up, went right back in the game. So I had to encourage her. I said, it's up to you to let us know, your mom, your coach, that something is not right, and realize that you are in the 7th grade. You still have 8th grade, you still have high school, you still have college. So you want to try to preserve what you can while you can, and use this time to get stronger and learn how to use your tool. So I do a lot of that education when I'm in clinic, because like I said, most of these kids don't need surgery or anything like that. They just really need to understand the processes that are going on in their bodies, and encourage the parents to kind of step in and step up to the coaches sometimes and say, no, he or she cannot do that this weekend. They can't do these 2 games or 2 tournaments or whatever. Or if there is an off season, let it be an off season, like a true off season, and outside of maybe some dedicated physical therapy work, for core strengthening and balance and, things like that. So I try to keep them at least engaged in something physical, all while resting the problem. The other thing I tend to see in children are a lot of knee overuse injuries, jumping injuries, so jumper's knee. And a lot of that stems from overuse for sure, but decreased flexibility of their quadriceps. And these kids are growing. And I try to explain to them, you're getting taller quicker than your muscles and tendons can stretch. So, right. Every time these kids hit a spurt, their pain usually goes whoop, and then if you ask them to touch their toes, they can't do it. Or if you ask them to flex their quad to their heel touches their bottom, they can't do it. And understandably, because you just grew 2 inches over the summer. Yeah. So everything's tight and stiff, but that is the example that I use for them and their parents and say, hey, you see this? This needs to be corrected. the standard is to be able to touch your toes without bending your knees. That's the standard. That's not, I'm not talking about gymnastics level flexibility. I'm just talking about, regular stuff. The standard is to be able to lie down flat, lie down prone, and bring your heel to your bottom without your pelvis thrusting backwards. So if you're not able to do those things, and some people have some other, underlying tightness that we have to consider, but for most purposes, that's not it. It's just the kids are not stretching, and they don't understand literally what's happening when they get taller. They just look like, oh yes, I'm getting taller, but everything else is trying to catch up with it. So you have to pay attention to it. And there's stuff you can do in front of the TV, whenever. I mean, now if you go to any kid athletic activities, you see the pregame stretching routine or the pregame practice routine, and it's just like nobody is actually even paying attention when they're doing this, and they aren't really, getting it done. So they feel like, no, I stretch every time before practicing. Before I was like, but are you really stretching? Are you really paying attention to what you're doing? Is anybody else paying attention to what you're doing, for that matter? So I try to encourage them to do that. And there's not, in my opinion, there's not ever too much stretching you can do, as long as it's self-motivated, and to tolerance, of course. Some other injuries I see, stress fractures. Saw that a lot in the military, a ton in the military, just because the recruit that we would see would sometimes go from doing nothing to doing something every day with a lot of intensity, and that in itself can cause problems. Not for everybody. When you have recruits that come in that haven't had the best diet in the past, haven't had the best level of any type of activity in the past, and they're getting subjected to this increase in activity all the time. So you start to deal with a lot of different things, overweight, poor nutrition, inactivity, of course. And then sometimes you're dealing with even more underlying problems with bone health. So with stress fractures, again, number one, rest. And, talk about being, well, luckily, or not luckily, I was at a basic training camp. So unfortunately, I would say stress fractures were kind of it was just part of the game, that was happening there. But in other places, it really is tough to tell a soldier. I was in the Army, so a soldier, you can't, I'm sorry. Crutches, toe touch weight bearing, if it's a femoral neck stress fracture, or crutches, if it's a tibial stress fracture or a foot stress fracture. With my middle-aged women, foot stress fractures are pretty common in runners. And that's just, again, because they just run. They may or may not have the right shoes. A lot of times people don't even understand if you just change your running surface, which is why sometimes on tracks they have the arrows that say Monday, Tuesday, Wednesday, go this way. Wednesday, Thursday, Friday, go this way, or every other day, or however they do it. And that literally is to change the stresses that you're putting on your body if you're going to come to that same location and run every day. You have to be careful, of course, with trail running, even uneven surfaces, because if you don't have the level of, first, if you don't have the right shoes and you don't have the level of balance and proprioception, that's going to put a lot of stress on lots of things, which brings you back to doing some cross training, right? To try to get stronger and to increase your the bottom line things that help you just do your activities of daily living better. Balance, core strength, things like lifting the correct way, all those types of things. So let's see, other common, or what types of overuse injuries? You guys by profession are pharmacists. Is that correct? Uh-oh. Man, wash you guys. Well, I think we may be having some connectivity issues. Well, I will say that it's good to spread the word about overuse injuries. I don't think you can hear about them enough, and it kind of goes hand in hand in with what an overuse injury is. The more you talk about it, I think the more you educate athletes and try to prevent some of these things. And the word athlete, I don't use lightly, but I try to explain to patients that even though they are not a high school athlete, middle school athlete, a collegiate athlete, by definition, if you are doing regular activity, physical activity, exercise activity, you should consider yourself an athlete. There are different levels to being an athlete, and I think that's important for people to understand. And I also think that helps them put things into perspective. If they look at themselves as someone who and identify themselves as an athlete, they may start to pay attention more to their preparation, just like any other defined athlete does, how they do during their sport and how they recover. And recovery is super important. You can think about how that is included with rest. So daily rest is one thing. And then you have what we spoke about earlier is seasonal rest. And again, rest can be active rest. It just needs to be something that's different from what the athlete has been doing on a regular basis. The other.
All right, Dr. Johnson, you still?
Yes, I kept talking. I'm not sure if that was supposed to happen.
No, it wasn't. We're having internet issues, and I apologize to everybody
That's
watching.
Okay.
That let's we're just gonna do this from our cell phones here.
Okay.
And see how good. So you were talking about stress fractures.
Mm-hmm. So I was saying that stress fractures are. I think we may have made it through the military portion of the stress fractures or those types of patients. And then I was speaking about middle-aged women who I see in my practice that have foot stress fractures. And it's usually because they're running and not changing it up. And we spoke about how you literally will go to a track and it gives you instructions to run one direction on some days and run the other direction on some days. Some of that is for the wear of the track. Some of that also, in my opinion, is to change the type of stresses that you're.
Sorry. Hold on.
There you go.
Okay, we're back.
Okay.
Sorry.
No, that's okay. Some of that is try to, in my opinion, to try to change the stresses that your body sees. So it's also important to, make sure your shoe wear is appropriate. Again, the stretching, the rest, all of that goes hand in hand with trying to prevent overuse injuries. The other thing that I think is important is, and I'm not sure if you're going to catch this when I kept talking. I'm not sure how that's going to edit, but is that I try to discuss with patients that you should look at yourself like an athlete. If you're participating in regular exercise, physical activity, sport, you should look at yourself like an athlete. I mean, you may not be that by somebody else's definition, but I feel like when they can start to see themselves that way, they pay more attention to their preparation, to how they actually participate, and to their recovery. Because everybody can. If I say, hey, you think about a professional X, Y, and Z athlete. That person does this. The only difference is they get paid to go to rehab. They get paid to recover, but it's still their body and they have to take care of it. So you meaning the patient, should do that to the same level. And I think that sometimes puts things into perspective from them, because most people don't see themselves as an athlete, but you're doing athletic things. So you have to prepare yourself to do athletic things and prepare yourself to recover, right? In order to be able to do those things the next time. So I also think that helps. There's not much that I would talk about yes, there are some things that become surgical in nature from overuse injuries. However, that's usually if we have failed to do the conservative part, which is to, in my words, shut the patient down, shut the athlete down. Like, can't do it, until you don't have pain when I push here, or, once you don't have pain when I push here, make sure you don't have pain with unloaded activities, just going through the motions. And then we'll start talking about doing other things. Now, during that time, when I say shut the patient down, it doesn't mean you're not doing anything. You're working on your core strength. You're working on your hip strength. You're working on, whatever it is that's going to fit you being safer in the future. That's what we're doing during the shutdown. And for kids that are in school, it's super important to keep them around their teammates. So I never tell them, I always say, still go to practice, still participate in the knowledge portion of your sport. Learn, watch film, do this. And I think that not only helps them stay up to date, so when it's time for them to get back in, they can kind of, jump back in, but it also helps with their psyche. We don't mention enough, probably the overuse part of this for some athletes, whether they be grade school, collegiate, or professional. I saw that a lot even in the military. I used to say I'm the doctor for America's sports team, being in the Army. And when they're not able to do their job, it really does wear on their mental. So I try to encourage kids for sure to stay involved, go to the game, go to practice. And I tell their parents that too, because they think since you can't play, you don't have to know, you come home after school. No. Let them still go to practice. Let them still be involved. And that helps with a lot of things. And if you have a coach or a coaching staff or a trainer that can kind of help reinforce that, then it helps a ton. It helps a ton. When it comes to above rest and cross training, I think anti-inflammatories are probably about as far as I typically go, outside of, ice or heat at whatever level. Anti-inflammatories are like the key to most pain control for the people that I see. Inflammation is huge. If anybody that comes to me and says, what, I can't take anti-inflammatories, and they have something orthopedic, I just say, oh my goodness, we're gonna have it's gonna be a little bit harder to control some of your symptoms. And I think that people overlook the value of an anti-inflammatory. Of course, it has to be taken safely, and keep into account if you have any reasons why you can't. But to recommend an anti-inflammatory early I think helps a ton. And I try to get people to understand, no, it is not fixing the problem, but it is helping with the symptoms of the problem, which will help you feel better. It helps with the inflammation and it helps with the swelling. Instead of you walking around swollen, inflamed, and painful while you rest, you can, help treat some of those symptoms. But as far as any other conservative management, other than what we've spoken about, physical therapy sometimes, depending on which injury we're looking at, and then anti-inflammatories, rest, ice. There's not much more than that. I hope to not get much more than that. If people do what they're supposed to do, usually we can get them back to sport. And of course, the return to sport. Now, that's the other part. It needs to be gradual and it needs to be purposeful. It can't be you were off for 6 weeks from throwing. Now you're back to throwing, as hard as you can, as fast as you can, for as many pitches as you can on Saturday. Like it can't be that way. So it has to, it's a whole process. And that's why I try to find somebody in the community that can help take that patient through that process. So the return to sport process, which I think is ignored more often than not in non-collegiate or non-professional athletes. It's like, okay, you're better. Okay, let's hit it. And that either leads to something else going wrong or a setback in what you've just gotten over. So this is multifaceted. I think if I'm treating overuse injuries in children and in adults, it's a lot of education, a lot of education. And I try to provide that not only in conversation, but in printed material, give people directed Google searches to do, because directed Google searches actually are good, but non-directed Google searches are not so much good. So I try to encourage them to do research on their own. I will say that with the rise of athletic training on the high school level specifically, I think that's helped a lot. When I was in school, we didn't have athletic trainers on campus. We had, I think, I grew up in the Houston Independent School District, which is huge, and we had, I think, 3 trainers for the district, and they were all housed at like the major football stadiums. So with having athletic trainers on campus, I think that helps a lot because they are an advocate for the athlete and they can do the go-between between the coach and the athlete and the parent so that the student doesn't feel overwhelmed and the parent doesn't feel like they're stepping outside. And then the athletic trainer can speak directly with me if needed. And we talk kind of the same language so they can help to reinforce things. When I'm not seeing the patient, they see the patient or the athlete every day. I see them once, every 3-4 weeks. So I think that's super important too with getting control of a lot of different things. And I was asking earlier, by trade, you guys are pharmacists?
That's correct.
Okay. So yes, you probably, when we talk about NSAIDs, I don't know. There's so many people that just like poo-poo NSAIDs. No, why would I take that? And I was like, well, it's actually very beneficial for you to take versus a lot of the other medications that are given out when somebody's, dealing with pain, which is a whole nother podcast.
Well, Jen and I are kind of weird pharmacists where, you're preaching to the choir with what you're talking about, conservative treatments, because especially long-term NSAIDs, short-term, sure.
Right.
But long-term drugs for any kind of overuse injuries and many other things, of course. It's like, why do you have the injury? Why do you need the NSAIDs? It's like you're throwing too much, you're running too much. Stop doing that.
Right. Exactly. Yeah. It even comes down to, a little off subject, but when patients come see me and they have longstanding knee arthritis, and when they see me, they have been on all these types of pain medications for a period of time. And I'm like, well, we can just definitively treat that, right? Because I do total knee replacements also. And then they're like, no, I don't want to have surgery. I'm like, well, ideally you should not want to have to take these medications every day
Right.
if you don't have to. And if we have an answer for it, maybe we should look into the answer, instead. So I try to, as often as I can, when I have the ears of primary care doctors and PM&R doctors and rheumatologists and things like that, people that deal with arthritic changes, it's like, hey, even if you just need to if you want to send them early, they're not ready, but they have arthritic changes, let them start to get to know an orthopedic surgeon so that we can start to, and you have to prepare people for those types of procedures. But like to your point, if there's something that we can fix, whether it be by rest or something conservative or something surgical, then that's what we're here for. That's what you all are here for, to recommend things that are better. And then when it comes to me, I'm like, if there's something we can fix, let's try to get it fixed. Even if I'm not the girl to fix it, I'll get you to the person to fix it if that's what we have to do. So I 100% agree with that.
Yeah, well, talking about your conservative treatments, Dr. Johnson, I mean, that's, surgery is a last option, and that says a lot, being an orthopedic surgeon. So I really appreciate you doing that, because I think, I think we see it and we hear about it often, and we see it that, there's probably some people that get unnecessary surgeries just because there's a, over aggressive surgeon.
Yeah. I make it a point to counsel my patients that even if they have an indication for surgery, first of all, orthopedics, most things are elective. Most.
Right.
There's a handful of things that if you decide to not heed my recommendation, that I'll be like, okay, I need you to sign this piece of paper that says you refused. But for the most part, most things are elective. So I always go through the, and I feel like it's my job, and I'm usually fairly point blank with people. You can do nothing. You don't have to do anything. It's not, this isn't going to kill you. It's not your heart. It's not your brain. It's not your lungs. It's not your kidneys. It'll make your life painful, but it's not going to kill you. So you don't have to do anything that I'm recommending. However, if you would like to get better, this is where I feel like we should start with this, and always let them know there's a progression, that sometimes, yes, when somebody shows up in my office, my first recommendation is surgery. Yes, but that's typically not the case with overuse injuries by any means, unless they've already failed everything and now they're being sent to me because they've already rested. They've already done that. We see that a lot with stress fractures. So they've already rested. They've already done a bone stimulator. They've already done this. They've already done that. Okay, now it's time to go in, debride the fracture site and fix it. Okay. But for the most part, I explain to people that for me, on the scale of conservative to aggressive when it comes to surgery, I'm probably in the middle, because I think that, number one, you have to be clear that most of what I treat is not going to kill somebody. Like, you're not going to die from it. So, and I think that point, unfortunately, was made very clear early in my career when the insurance company would say, no, sorry. And the patient would end up coming at the end of the year once deductibles are paid up and da. So, with that, instead of me getting like really frustrated, I was like, well, why? Oh yeah, well, most of the stuff, it's not a heart attack. They don't need a stent. It's elective, and I understand that. So I push conservative management as often as possible, and also I let patients know, in a lot of situations, if we are doing conservative management, and even if I feel like we've exhausted it, I let them know, you'll come tell me when you're ready.
Right.
Yeah,
it's true.
You'll come tell me when you're ready. And I think that also helps the patient deal with the aftermath of surgery, because now they came and said, Dr. Johnson, I'm ready to have this done, versus Dr. Johnson saying, you got to have this done. So now the pain after surgery, the rehab, the this, and we talk about it. I'm like, you remember you came and told me you were ready, and we talked about all of this. So I think it helps put things in perspective. It also helps me get to know the patient. I tell people and patients all the time, you are interviewing and your doctor's auditioning, but you're auditioning too as a patient. Like, right. I want to get to know you, and I want to know that we're going to be a good fit with my level of communication and your level of communication, and being able to actually follow through on things. Because once I do surgery, it's like you're mine. I'm responsible for everything that happens after that. At least that's how I feel. So I pick and choose my cases really specifically, because it's not just about, you can operate on everything. I mean, you really could. But whether or not you're going to actually make a difference in that person's life if you operate is one question I ask. Whether or not they've exhausted conservative management is the other question I ask. And then whether or not they're ready for it. Because sometimes they're ready for it in their head or body. But I literally ask questions like, okay, do you have anything coming up in life that's going to get in the way of you doing your rehab? Oh, or my son is getting married in 3 weeks.
Yeah, right.
We got to wait.
Right.
Yeah, we have to wait, because we need you to be focused on your rehab, and we need you to be able to step back. We need you to be able to take time off of work. We need you to be able to do all of that. And I honestly think that, and that's one of the reasons I now have my private practice, because I can spend time with my patients and talk and educate and get their opinion, make sure they understand what's going on, make sure they understand, now this is your part. This is what you have to do. This is my part. This is your part. And then go through all those steps versus feeling like I'm under the pressure of, 15, 20 minute appointment slots.
Absolutely. Yeah. Mm-hmm. So tell us, as we wrap this podcast up, Dr. Johnson, tell us what you have a passion for.
As far as career goes or work goes, I have a passion for educating patients. I think that is the single most overlooked aspect of a doctor's day, is that it's not that we don't want to, but I think we don't have time to. And some patients need more time than others. And depending on how your day is going, if the patient feels rushed, they may have questions and they just don't ask them because they feel like they're getting in the way. So I try my best that when a patient leaves, they understand what's happening. Even if it's, Dr. Johnson can't help you with this, but Dr. Johnson's going to help find who can help you with this. So I charge myself with being a whole patient doctor, and making sure they, I educate patients, making sure they have what they need, even on the primary care, side, because so many people start off in a system at orthopedics. They break something happens, and they go to the ER, and the first doctor they've ever seen is me, that's going to manage their whatever. But so many of them need other healthcare providers in their life. So I try to do that. So I'm really passionate about education and making sure people are taken care of. Outside of work, my family and friends are like my thing. I've had I have different circles of friends, most of us do, but I have my childhood friends from like 6th grade to now. And then I have my college friends, and then I have my Army friends. And the good thing about my friend circle is that we can all do this, and we can all come together. And I give my childhood friends and my college friends credit for keeping me even when I was in medical school and in residency and in fellowship and in the military, deployed, doing everything. They always were able to keep me even. We just celebrated my best friend's 50th birthday. And it was super important for me to be present and to help her husband, make it the best thing for her, even though they were more focused on going to their son's Little League football game on that day. So I had to reel them back in. I was like, hey, Mason is 9. He will be fine.
Yeah.
Let's celebrate this milestone. So family and friends are super important. My mom recently moved closer to me about 3 years ago. She's 78 and very independent, but she was living about 4 hours away. And I was like, okay, that's not okay. You need to come closer. So now she's like 4 minutes away. So, yeah, that's pretty close. And then my husband, I don't have my own children. My husband has 2 children, a daughter and a son. And our daughter had a son 2.5 years ago. So we have a 2.5-year-old grandson in the house with us. So I say I don't have my own children. I've never birthed my own children, but my goodness.
Yeah, right.
Yeah. And he's in the house with us. So he's brought a level of, joy and passion to my life that I hadn't experienced it before and wasn't sure how. I was really nervous. I was like, I've never done this before. And she was a young mom. And I was like, I don't know what to do. And my husband always encouraged me. He's like, well, you care about people. You'll be fine. You'll be okay. So,
So if anybody has any questions, Dr. Johnson, how should they get a hold of you?
So you can definitely visit my website, and I have Instagram and Facebook. On my website, there are a couple of different ways that you can reach out to myself and my assistant. There's an email address. That's info@drshawnmdortho.com. There's a phone number, which you can also text that phone number, and it's 936-463-1913. And then I also have an option for a telemed triage, because sometimes people don't know where they need to be seen. And that triage gives them 15 minutes with me. Of course, it does cost, but 15 minutes with me to determine if I'm who they need to see further, or if not. Because unfortunately, one thing that I also am very passionate about is not wasting resources. And to see patients that end up in my clinic with, say, an operative spine problem, for me, I feel like we have done a disservice to that patient, because I don't do surgery on spine and I don't treat it definitively. So I try to, get ahead of that on patients and try to get them in the right direction, because number one, you're hurting. Number one, it costs money for you to come see me. Number two, and then to come see somebody and you think this is where it's going to happen, for them to say, oh, no, sorry, I don't do that.
Right.
So that telemed triage helps to make sure people are getting in the right space. And it also helps, just for us to have a quick conversation to see if we're going to be okay. I see clinic in several different places, and that's been a product of me trying to keep my overhead down. So I actually see people in 3 or 4 different spaces. And I also have the ability to do mobile visits to assisted living locations and independent living locations. I think the most special and different thing about my practice is it is direct care. The only commercial insurance I take is traditional Medicare, and that's just because my patient population was a large Medicare population, and I didn't want to leave them out when I moved on from the last practice.
Good for you. I'm excited for you. And you've helped us realize our goal today of our podcast, which is to educate, like you said, educate and empower individuals to take charge of their own health. So thank you for helping us realize that goal. And I wish
Thank you for having me. I appreciate it.
I wish you the best in the future, and let's stay in touch. We can have you on again.
Will do. Thank you so much. You all have a great rest of your week.
You're welcome. So you've been watching Health Solutions with Shawn and Janet Needham. Tune in Monday where Greg Bickle, he's a physician's assistant, will be talking about running a successful independent family practice. So you don't want to miss out on that. Health Solutions with Shawn and Janet Needham. Thank you.